Mark Steffen's Good Day program. Ken Jenkins is a professional emergency manager with extensive experience in planning, logistics, training, deployment, response, after-action analysis. He's built a remarkable track record successfully preparing for and responding to emergencies ranging from severe turbulence encounters to terrorist attacks on September 11th. He's an aviation emergency crisis consultant. Who knew there were people who did this? Ken, welcome to Good Day.
Good morning. How are you, Doug?
Well, thank you. Tell us about the experience that you've had, the most trying problem you've had to deal with to date when it comes to this sort of crisis.
I would say the most trying or most challenging would have been the response to September 11th, simply because of the enormity of the event, the coordination of all the activities that had to take place, difficulty in moving people to be in place because the air system was shut down.
Right. A lot of people are demanding to know why the government has been so impotent thus far. Our government, other governments, they just talk, and meanwhile Ebola patients are dying literally like flies in the streets of some of these countries. What is the problem? Why can't we just come to grips and never mind talk about having a survey, but actually keep these people from coming into our country? If they're in any of these countries where there's a problem, just don't let them in.
Well, and what I don't understand about the current situation is that there is a lot of activity that's going on that isn't being discussed right now. There are quite a few of the locations in Africa where airlines are no longer flying. They're not flying in and or out of those countries, and if they are, they're only for humanitarian purposes. But even within our own country, between the Department of Transportation and the CDC, they have aviation resources for quarantinable diseases. And by that I mean that they have processes already set up, and they did way back when the pandemic flu was supposed to be the big epidemic that was going to hit the bird flu. And that would be what to do if you have somebody that was sick on a plane coming into the United States. Well, even prior to that, airlines, even those flying today, have their own line of defense through their frontline employees and airport employees. And meaning if a flight attendant, for example, saw that somebody was sick on a plane, was showing certain kinds of symptoms, they would go to the cockpit to tell the pilot that this is what they were seeing, who would contact medical department for that airline, who would contact the CDC or the local public health department to meet that plane on arrival in that location. And that happens today, even before Ebola broke out. There are 20 quarantine stations for the CDC around the United States. And this has been a very active system for years, and yet there seems to be no discussion about that process in place today.
The guy who runs the CDC says 77 people have been pulled out of lines to board flights from these countries. That seems like a pittance to me. Seems like almost nonsense.
Well, it does. It does seem small, but at the same time, that's a good sign. We certainly don't want to see that number increase, but it does also show that that's how well their active system of screening is going. The country of Nigeria, for example, is what you can see on the news recently is that it looks as if they've stopped the outbreak in that country. And the first line of defense is through your active system of screening to see if somebody has a fever, for example. So they're doing that at the outports. And now they're looking at, in the United States, at 4 of the ports into the U.S. in Chicago, JFK, Newark Airport, and Washington Dulles, looking at having arriving flights from international locations, having an active system of screening there, too, to see if you can find out if somebody has a fever, which could be the first symptom of Ebola, or a number of other quarantinable diseases.
One of the things I thought was interesting and sort of sad, we think about Ebola and how it affects humans. There's a dog named Excalibur who was the pet of this nursing assistant who had Ebola being euthanized because there was a chance the dog might have been able to spread the disease. I did not think this was something that went from humans to dogs, but apparently it does.
Well, and I had not heard that, and I would certainly be interested in knowing then we would go about screening
that's
dogs
the point.
and cats
Exactly.
and other pets.
Yeah, another thing to be concerned about. All right, well, this has been helpful. I think we ought to have more conversations like this with more people like you, so people in Washington get the message. We want these people kept out of our country. Ken Jenkins, you can check out his website, KenJenkinsSLLC.com, KenJenkinsLLC.com.